Okay. So thank you so much for coming. My name is Nancy Arelli with Community Living Advocates. Thank you so much. Thank you for introducing yourselves. I love seeing you all, and I'm so glad you're here. I wanted to let you know that both Senior Fair and a bag events that we had went pretty well. I'm really excited about that, and I am speaking with some different Meals on Wheels in the area to see if we can do some more, so stay tuned for that. Coffee Net that I used to have on Friday mornings has changed to Thursday mornings at 9:30. And I've also started up a new event called the CNY Senior Talent Show 2020 with Gwen's Helping Hands. And hopefully you got that information in your email yesterday. If you are interested in it, if you have a resident that's interested or a client or yourself, anyone 55 and over can register and be in the talent show. So I wanted to say thank you. And then let's see, I want to introduce Sarah Askew with the MCCAP Counselor for Central New York. She's going to represent first for statewide. So Sarah, if you'd like to take it away. Sarah, can you hear me? Because I can't hear you.
There we go. How's that better?
Perfect. Thank you.
Sorry. Okay, let's try this again. So work with statewide Senior Action Council. We help with Medicare, general questions. If you have questions about enrollment, plan comparisons, things like that, we can help with that. We help with patient rights and Medicare fraud as well. And for patient rights, we can help with questions about quality of care, questions about accessing care. In COVID times, we've had a lot of questions regarding nursing home visitation and being able to see your loved ones in a nursing home and the different rules regarding that. So we can assist with those sorts of things. Assist with notices you might receive or don't receive that you should have. So anytime you have a question about patient rights, feel free to call us. Feel free to have your clients call us. We're always available to help. And the Medicare prescription drug coverage, like I said, we can do plan comparisons. It's open enrollment now until December 7th. And we just help with general information to help people pick plans and get the information that they need. I know Eric's going to cover that in depth. So we also help connect services and benefits for seniors. So we get calls from people just wanting to know in general, like services that are available to them on the local, federal, state levels. We get questions about heating, housing, food insecurity. So we connect people with various resources. We have a great network through our agency and a lot of great information that we can send to people. We can send to you to distribute in your agency if you want to have some information. We have a lot of that. So feel free to contact with any questions, with anything like that. And we do a lot with Medicare fraud as well. So Medicare fraud, there's a difference between fraud and abuse, and the difference generally lies in intent. Medicare fraud is when somebody intentionally, knowingly tries to kind of trick Medicare, bill for things that didn't happen, bill for services that didn't happen, fraudulently get somebody's number to do nefarious things with that. And then Medicare abuse is more when there's a situation, maybe a provider billed for something they shouldn't have and didn't realize, and that's more of an abuse situation. Either one should be reported. It's a really serious issue. In Medicare, fraud and losses to taxpayers are over $80 billion a year, and that's with a B, billion. And then in New York State, it's over 5 billion, again with a B, losses annually, which puts the Medicare Trust Fund at risk. So absolutely, if you have any concerns, feel free to call us. We'll help you with it. And then authorities can make the determination between abuse and fraud. And some examples, these are some brief ones. I've got some more for you in a moment, but billing for services, supplies, equipment that are not provided, calling Medicare beneficiaries and trying to get them to give you their number over the phone. That's a lot of things that happened. Billing for medically unnecessary services happens a lot. So be careful with that. And it affects everybody because it affects taxpayer dollars. So this is an issue that has a really big impact on everybody in the nation. And this is the number for the Medicare Patrol, Senior Medicare Patrol, SMP. And the Senior Medicare Patrol is a federal grant-funded program. And the mission of it is to educate beneficiaries and family members, community agencies on how to prevent, detect, and report Medicare fraud. New York statewide is the grantee for New York State. There is only one grantee for each state, DC, and its territories, so we're the one for New York. And once somebody becomes a victim of Medicare fraud, they can really have their medical identity compromised, which can lead to a lot of inaccurate medical information being associated with them and can lead to a lot of greater issues. And we can help navigate that process. We can help report to the U.S. Office of the Inspector General and help with those sorts of things. These are some additional types of Medicare fraud to keep a lookout for. There's been a real rise in genetic testing fraud because that's something that's kind of caught on, you know, getting the genetic testing kits for Christmas and things. So that's something that is a very lucrative market. So they'll come and say, like, I can do a cheek swab and test for this for you. And that's something that a lot of people have had happen. So just be on the lookout for stuff like that. Medical card scams, they have people call to say, we're going to send you a new card in the mail. We just need your Medicare number. So they try to get them to give their Medicare number out over the phone. Durable medical equipment fraud is something that I've seen. I've had a couple cases recently, people receiving braces in the mail that they didn't order and don't have any idea why they're getting them, and things like that. So those are a lot of different frauds out there, unfortunately. And these are just some of them. Again, you can always call the SMP helpline if you have any concerns, any questions at all. We are always, always there to help. And then unfortunately, due to COVID, there's been a rise of frauds specifically related to that. And it's unfortunate in the middle of a pandemic. That's something in addition you'd have to worry about. But sadly, the longer it's happening, the more we're seeing come up with issues like that. Be really cautious. Please warn everybody that you work with. Be cautious of anybody who comes to your door offering free services, anything to do with COVID, like free treatment, testing, supplies. That's usually going to be a scam. We always encourage people under any circumstance to please review Medicare summary notices and your explanation of benefits. They're very important and they have a lot of good information. So we really encourage people to look at those closely when they receive them in the mail. And don't give out Medicare number, Social Security number, anything like that over the phone. Don't give it to anybody who calls you or stops by your house you weren't expecting, you don't know who they are. Don't give it out. Treat it like you would your credit card number. Treat it really close to you and don't give it out to people that you don't know. And there's a lot of email scams where you'll get a link sent to you, so don't click on that, obviously, because that can lead to a lot of other compromising issues for your system, and then you get viruses and a lot of other issues. There's also been a rise in scams related to vaccines and vaccinations, specifically to COVID. Information about cures for COVID and things like that that are out and about. So just warn people, there's nothing official out yet, so just be really careful. Be cautious for those sorts of things. Also, same thing when you're purchasing medical supplies from unverified sources. If there's like an online ad that you're clicking on because it seems like a great deal, just be really careful with it. You can always call Medicare to see who is associated with Medicare. So you just want to be really careful that you're not getting fraud coming from that area. And these are just some tips on protecting yourself and for medical identity theft. It affects 1.5 million Americans, so it happens to a lot of people. It's actually really common, and it can be expensive to fix and time consuming. So it's easier, obviously, to just avoid it altogether in the first place. And Medicare ID theft is somebody stealing your information, and then they'll use that to potentially get medical treatment and get prescriptions and other services that they will then bill Medicare for under you. And that can be really dangerous for people because it can lead to an inaccurate medical record being created. There can be denials of services, denials of equipment because Medicare thinks you already have it because somebody billed it under you and they don't know that it's not yours. And you also don't want any kind of inaccurate Medicare medical information in your record. like different blood types, inaccurate histories of drug, alcohol use, allergies, different things like that, that can lead to a lot of greater issues with care. You can receive wrong treatment and get a lot of problems with that. And so we ask that you, again, always review the Medicare summary notices and the explanation of benefits. That's a great place to notice if there's any kind of issues. If somebody gets a bill for a medical service that they didn't have, if they get information from a doctor that they don't recognize the name. I've actually had people receive braces really in the mail that they have never ordered, don't know, doctors they've never heard of from places they have never been. If an insurance company denies you benefits because it's a medical condition you don't have, or they say it's a surgery you've already had or some kind of a yearly benefit you've already used and you haven't, definitely check into that. And we would say to not ever give your personal med information out, only to approved doctors, SMP program, anything like that. You can always call 1-800-MEDICARE if you aren't sure if a provider is approved. And they can always tell you if you have any concerns, just hang up, call Medicare, call us, and we will definitely help you. And the old saying of if it's too good to be true, it probably is accurate still, unfortunately. So if you get any like offers of free equipment, services, goods, I just need your number and I can give it to you for free, it's a scam. Be careful. Don't take the bait. Check into it before you do anything with that. And definitely shred papers before you put them into the garbage with any kind of identifying information, which is true for anybody and always a good thing. If you ever think that there's been an error or an issue, you can ask for a copy of your medical record so you can see and actually look at that from your doctor to see if there's any issues. And you can always ask for presentations too for your agency or local communities. We're happy to do that to educate people on what to look for. Specifically times in COVID, there's a lot more of a rise for things like that. And we're always available to help with questions. Feel free to give our number out to people. We'd like to help. And this is an upcoming event that I just want to let you guys know is happening, and it's for utility consumers in New York State to give them some information. Heating season is coming up, winter is coming, so there's a lot of questions about that every year. What people qualify for, what their rights are, how to deal with getting service, how to deal with issues with service. So this is going to be great. And Nancy said she'd send all this information to everyone, so don't feel like you have to scramble to write it all down. She said she'd get it out to everybody. But this is going to be a really great program that's coming up. That'll be on the 27th, which is just in time for snow, sadly. And then I also wanted to give you my contact information. That's the 1-800 number you can reach me at, my fax number, and I have a PO box as well. If you want to physically mail me things, you can do that, and you can also email me directly. And you can also go to our website. It has a ton of great information. There's a lot of, if we have events coming up, that's on the website. We have a lot of resources and help. If it's a great starting point. And if you ever have additional questions, always feel free to contact us. And really just go ahead and give the number out. Like, we're here to help. We want to communicate with people, and we want to really help provide seniors with the services and the care that they deserve in the community and make sure that they're getting the best that they can get. And now is a really time when they're really, I think, having a lot of isolation issues and feeling really disconnected and feeling really alone in a lot of situations. So it's important for them to know that there are people out there who just want to help and who are just here to advocate for them and really assist them in any way we can. And, Eric has a lot to get through, so I will not keep you too much longer, but just feel free to contact me anytime.
Thank you, Sarah. Okay, next we're going to have Eric Hausman. He is Medicare Training and Education Consultant, lead trainer for the New York State Office for Aging, the HIICAP program. So Eric, take it away.
Okay, thank you, Nancy. So today, what I wanted to do is a Medicare update, the top 10 things to know about Medicare. And we have a slide on EPIC also at the end. So let me just go to the slideshow. Here we are. Okay. And the first has to do with Part B enrollment. And we get so many questions about Part B enrollment now. Do I have to sign up? Is it going to be automatic? If I don't sign up now, can I sign up later? Will I pay a penalty? Those kind of questions. So whenever I talk to people that are new to Medicare, that are just turning 65, and I do that all the time nowadays, my first question to them is always, are you collecting Social Security? Because I know that if you're collecting Social Security prior to 65, you're going to be automatically enrolled in Part A and Part B. And some people on the call today may remember that at one time, the full retirement age for Social Security was 65, and Medicare was 65. In those days, most everybody was automatically enrolled in Medicare. It was much simpler back then. But today, the full retirement age for Social Security, it's working its way up to age 67. More people today are deciding to collect Social Security after 65. And if that's their situation, they will not be automatically enrolled in Medicare. They will not. And to get Medicare Part B, you can only enroll during a specific enrollment period. There are 3 Part B enrollment periods. I want to concentrate on the special enrollment period, but before I do, let me just tell you briefly about the other 2. The initial enrollment period is when people are first eligible to enroll in Part B. It's a 7-month period. For most people, it's the 7 months surrounding the month they turn 65, right? The 3 months prior to the month they turn 65, the month they turn 65, the 3 months after that. And if they enroll in Part B in any of the 3 months prior to the month they turn 65, their Part B starts the first of the month they turn 65. Now, if you don't sign up during the initial enrollment period, some people may have to wait until an annual period. It's called the general enrollment period. That's every year from January through March. And if you sign up for Part B during that time, your Part B doesn't start until July 1. So whenever you come across somebody that has a Medicare card, they have Part A effective years ago, but Part B is effective a more current year, and it's July 1st of that year, chances are that's what happened. They didn't sign up when they were first eligible. They chose to sign up later. During the next general enrollment period, it didn't start till July 1st. And those are the people that may be paying a late enrollment penalty for Part B. And the late enrollment penalty for Part B, it's 10% of that year's standard premium for every full 12 months they delay. And that 10, 20, 30, 40, 50, 100% or more penalty, not one-time penalty, it's a lifetime penalty. So the only people that would be well advised to delay enrollment in Medicare Part B, who can sign up later without having to wait and without paying that late enrollment penalty, are the people that qualify for this special enrollment period. So in order to qualify for the special enrollment period, you need to be covered starting that very first month you turn 65 under your own or your spouse's active current employment, not retiree plan, not COBRA, active current employment. If you don't have coverage through active employment starting the month you turn 65, the other way to get it is if you sign up in Part B during that initial enrollment period surrounding the month you turn 65, and then later you go back to work, or a spouse goes back to work, and now you have coverage through active employment, you could drop Part B, it'll end the end of the next month. And as long as there's no break from when your Part B ends and your coverage through active employment begins, you can have that same Part B special enrollment period. So it's very common for people that are still working past 65, especially if they're working for a large employer where the employer insurance would be primary. They might take Part A of Medicare because there's no premium, but they often delay enrollment in Part B. Why? To save the monthly premium. And then when they retire 3 or 6 years later, they use that special enrollment period to get Medicare Part B without having to wait and without paying a penalty. So when does the special enrollment period allow you to sign up? Well, the special enrollment period allows you to sign up while you're working or within 8 full months following the month you're no longer covered through active employment. So if you qualify for the special enrollment period and you stop working today, they'll give you the rest of October, 8 full months beginning in November to sign up for Part B. When does it start? It depends when you sign up. If you sign up while you're working, okay, that first month you stop working, or the first of those 8 months, it's your choice. It could be retroactive to the first of the month you enroll. And you might need it to be retroactive. So if they fire you from work today and they terminate your insurance immediately, you may not want to wait till November 1st. You may want them to go back to October so that there'll be no break in coverage. But if you don't need it immediately, you can request one of the next 3 months. It's your choice. So I have people telling me all the time, they come to me, they've been working since 65. They're getting ready to retire. They know their retirement date in advance. And they'll say, how early should I contact Social Security to sign up for Part B? And I'll say, contact them 2 to 3 months before your retirement date, because I know if they enroll while they're working, they can request Part B to be effective up to 3 months in advance. If you sign up during that last 7 months they give you, it's just effective the first of the following month. Now, a big problem we see with relating to the Part B special enrollment period is for people that don't have coverage through active employment, but instead have coverage through COBRA. Okay? If you ever meet anybody that has COBRA and they're thinking about delaying enrollment in Medicare Part B, that should be a big red flag for you. Because with COBRA, COBRA's not insurance based on active employment. COBRA's insurance you have from your former employer or from your spouse's former employer, that when you stop working, they offer that to you for up to 18 months. Most people can get COBRA up to 36 months in New York State. A lot of times people are on COBRA, they think they don't need to sign up for Medicare Part B. That's a big mistake. That's a very big mistake. Okay, again, when you're on COBRA, you're no longer actively employed. COBRA does not extend the time you have to enroll in Part B because it's not coverage through active employment. That's problem one. The other problem is when you're on COBRA, you're not actively employed. That means that Medicare is your primary insurance. Okay? Even though you might be within the enrollment period to sign up for Part B, and Medicare doesn't have a problem if you don't take Part B right away, if you don't sign up for Part B, you might find that the COBRA insurer no longer wants to pay as primary. And you can understand why, because if you took Medicare Part B, the government Medicare program would pay most of the cost. So does the COBRA insurer want to continue to pay for you, especially if you're really sick and use a lot of medical care when they realize you're 65 and are eligible for Medicare? Sometimes, but a lot of times no. Or the worst is when they do pay as primary and then realize sometimes years later that, oh, wait a second, you should have had Medicare. Now we want the money back. Okay, so again, usually people are on COBRA. COBRA is expensive. Those people, they can't wait to turn 65. Get rid of COBRA, take Medicare, save some money. But for some people, COBRA is a good deal, okay, because it's being subsidized by the former employer. They're getting some sort of severance package, right, where they're getting subsidized health insurance for 6 months or a year, okay? It's helpful in one way, especially if they have other dependents, right, that they're covering under that subsidized COBRA. But again, it does not extend the time they have to enroll in Medicare. And when you're on COBRA, Medicare is primary. And if you're not taking Part B right away and you're counting on the COBRA insurance to continue to pay as primary for you, you're taking a chance, big chance. Okay. Are there questions so far about Part B enrollment and about COBRA?
I have a situation with working with Meals on Wheels that if you have less than 20 employees,
Yes.
you need to sign up for Medicare.
Sure, let me explain how that works. That's another problem. This is often a disconnect between Social Security that handles enrollment in Medicare and about Medicare itself. So if you're eligible for Medicare due to age 65 and you're working for a small employer, less than 20 employees, Medicare is actually the primary insurance. Now, if you're covered through active employment, you can delay Part B with any size employer and qualify for that special enrollment period and sign up later without having to wait or pay a penalty. But if you're working for a small employer, although Medicare allows you to delay, if you do in the end, you might find you have no health insurance that wants to pay. Because like the COBRA insurer, does the small employer insurer want to continue to pay as primary when they realize you're Medicare eligible, right? A lot of times they won't, okay? And we can understand why. So people that are delaying Part B because they're covered through active employment with a small employer where Medicare would be primary, they often, in the end, although Medicare allows them to delay Part B, in the end, it's really not a choice for them. They have to take Part B or else they have no primary insurance, like the person that has COBRA. That's a good example to bring up. Thank you. Were there other questions on the Part B enrollment and COBRA or other scenarios? If not, I'll continue.
I have a question. Can you hear me?
Question first. Yes, go ahead.
What about a person who is self-employed with subsidized insurance from a prior
Self-employed,
employer?
that's another one that people should be cautious about delaying. So if you are somebody that wants to delay Part B to get the special enrollment period, you need to be covered under what they call an employer group health plan. An employer group health plan is a plan that offers insurance not just to you or you and your family, but to at least one other employee. Okay? Most of the self-employed individuals that we come across, they have a plan that just covers themselves or their family. That's not an employer plan. They cannot delay enrollment unless they bought it through some sort of association like the Chamber of Commerce, something like that. But otherwise, if it's just a self-employed person, maybe they got their plan through the marketplace, through the exchange, they cannot delay enrollment in Part B without penalty. Again, it needs to be an employer group health plan.
May I follow up?
I'm sorry?
Can I follow up with, so the situation is this person is retired and has subsidized insurance from a prior employer.
Okay. Well, the retiree is not able to delay enrollment in Part B
Okay.
without penalty because in order to delay enrollment and get that special enrollment period, you need to be covered through your own or your spouse's at 65 active current employment.
Thanks.
If you're retired and your spouse is retired at 65, you would probably want to enroll in Medicare when you're first eligible.
Thank you.
Sure, you're welcome. These are all good questions to ask. So let's talk next about the Part B premium. We don't know yet what the Part B premium will be for next year, okay? But we did just learn last week that the Social Security will be increasing by 1.3% is the cost of living adjustment for next year. And I want to talk about how that impacts on the Part B premium. Social Security has this protection, it's called hold harmless. That's how we refer to it as, where they do not allow a person's Social Security check to go down from one year to the next because of the increase in the Part B premium. So the predicted Part B premium next year, this is only a prediction, is that it's going to be $153.30. If that goes to $153.30, they're going to look at each individual, okay, that's collecting Social Security that has Part B. And if that 1.3% increase is enough to cover the increase in premium, and it will for most everybody, because the average increase will be at least $15 to $20 in someone's Social Security check, then they will just increase the premium to $153.30. But some people have very modest Social Security benefits. For them, the 1.3% increase is not enough to cover the increase in premium. So what happens? Well, those people will not see the increase because whatever the COLA increase, that few dollars it would have gone up, the premium will also go up by the same amount. And for them, it'll just be a wash for 2021. Okay, they can't allow the premium to go up and reduce the Social Security check, okay? So again, they can only raise the premium up to the increase in the Social Security benefit. Now, who's protected with this hold harmless? The people that are collecting Social Security, of course. If you're not collecting Social Security, there's no check to protect from going down, so your premium's going up next year for sure. And the people that are paying the standard premium, okay, the $144.60 this year. If you're paying a higher Part B premium, the IRMA premium, the income-related monthly adjustment amount based on your income, there's no protection for you. And if that premium goes up as expected, your Social Security check could actually go down. Okay? Again, this protection is only for people that are paying the standard premium. The other thing to know about this is that the late enrollment penalty for Part B, whether it's 20% or 30 or 50% that you're paying, it's always based on that year's standard premium. So this year, anybody that's paying the penalty, it's a percentage of 144.60. Next year, it's going to be the same percentage of a higher amount. So you might have people whose Social Security check is reduced, not because of the increase in the premium, but rather because of the increase in their late enrollment penalty. Okay, and I always look for that for people whose Social Security check goes down from one year to the next. Okay, so that's the story of the Part B premium and hold harmless, and we'll know more when the final premium is announced, the end of this month or beginning of November. And next, I wanted to talk about an item that's impacted under original traditional Medicare, and this is for durable medical equipment. And it's competitive bidding. So some of you may remember that years ago, Medicare used to set the rates for durable medical equipment and supplies. But what they found was over time, those rates that they sent did not reflect the true market value, and that Medicare was overpaying for equipment and supplies. So they replaced that system with a competitive bidding system where suppliers, to remain in the Medicare program, they had to submit bids. And then Medicare set the rates based on those bids, and they saved money for the program. They suspended this competitive bidding in 2019 and again this year, but it's coming back in 2021 for beneficiaries that reside in most, if not all, of New York State for these 15 product categories, just these 15 listed here, including things like oxygen equipment and wheelchairs and walkers. So next year, if you're on original traditional Medicare, as opposed to a Medicare Advantage plan, and you need one of these types of equipments and you reside in a competitive bidding area, you have the link to check if your client does, then you must use a contracted supplier in order for Medicare to pay. And the good thing about the contracted suppliers is that they are mandated to accept Medicare's assignment on claims, meaning they are mandated to accept whatever Medicare allows as their full payment, in which case the beneficiary is responsible for that annual deductible plus the 20% coinsurance. Okay. Is there any question about these last two slides before I continue? Okay, so when we talk about original traditional Medicare, Part A hospital, Part B medical, there are big gaps in coverage, deductibles, coinsurance. So we next have to talk about filling in the gaps. Some people have retiree health insurance from their own or their spouse's former employer or union that fills in all or most of the gaps. Other people that have very limited income and resources have Medicaid, and Medicaid fills those gaps. But most people today don't have the retiree coverage and don't qualify for Medicaid. They're the ones that may purchase a private Medigap, a Medicare supplement plan, like you see advertised on TV, right, from AARP. But there was a big change to Medigap insurance that happened this year for people that are new to Medicare this year, new to Medicare, meaning somebody that's becoming entitled for the first time, such as somebody becoming 65 this year. They are not eligible to purchase a Medigap plan that covers the annual Part B deductible, the $198 deductible this year, meaning they cannot purchase Medigap Plan C or Medigap Plan F, including the high deductible version of Plan F. Okay? Now, there's a lot of confusion I find about this because there are a lot of people that were eligible for Medicare prior to this year, but were not enrolled in Medicare, at least Part B, until this year, because maybe they stopped working this year, right? Those people can get CRF. So it's not necessary for you to have been enrolled in Medicare prior to this year. It's just necessary for you to have been entitled to Medicare. So again, if you were 65 last year, but you delayed Part B because you were still working, you lost your job this year, you signed up for Part B using that special enrollment period we mentioned before, you can get CRF, no problem, okay? But again, the new people just turning 65 this year, you can't get CRF. You can get Plan D or Plan G, which is the same plan, it just doesn't cover the deductible, but not the more comprehensive Plan C or Plan F. So what does that mean for people? It means that there's more and more people today that are on original Medicare that have to pay that deductible out of their pocket. So we get more questions about how the deductible works. Well, the deductible is not necessarily applied to the first services you have each year, but rather to the first claim or claims that Medicare receives. So sometimes you may have a situation where somebody goes to the doctor at the beginning of the year. The doctor asks them for that deductible up front, which they're allowed to do as long as Medicare allows at least that much for their services. Then a couple of weeks later, they go to another doctor. If Medicare gets that second claim first, they don't know that you went to the doctor at the beginning of the year. They're going to apply it to the first claims that they receive. And then you need to get a refund from the first doctor. But that first doctor doesn't even want to refund you the whole amount because only would have paid it 80% anyway. Just creates more confusion. So what I've always told people is, unless the doctor's insistent upon collecting that deductible up front, avoid paying it until you see where it's applied, okay, and exactly who you owe it to. Because people think, you know, when they write a check to the doctor at the beginning of the year for $198, that means they've met the deductible. But again, that's not how it works. The deductible is only met at the point that claims are submitted to Medicare, processed, and applied to the deductible. So again, one problem with that deductible, as time goes on, more and more people have to pay it out of pocket because more and more people are new to Medicare and they can't buy a plan that covers it for them. And as the deductible goes up, it's more and more likely that it's met not just on one claim, but on two or more claims. Okay, so that just adds to the potential for confusion and encourages people, again, if you can, to have them avoid paying the deductible until they see how it's met. Now, they don't want to wait until they get a Medicare summary notice 3 or 6 months later to see how it was met. Instead, they could always check on the phone with Medicare, 1-800-MEDICARE 24/7, or they can sign up and create a mymedicare.gov account where they can view their deductible and other claim information right online. That's the story with the Medigap change and the Part B deductible. Is there a question on that before I talk about Medicare Advantage? Okay, so there's two ways that people can get the Medicare. So far, I've spoken about one, original traditional Medicare, and that might come along with a privately purchased Medigap plan. The other way to get your Medicare is to join a Medicare Advantage plan, a Medicare health plan. And these are plans that are contracted with the government to provide all of a person's Medicare benefits through a network of doctors and hospitals. And I want to talk about two changes that are happening for Medicare Advantage plans for 2021. One is in the out-of-pocket limit, and the other is about for people that have end-stage renal disease, kidney failure. Now, all Medicare Advantage plans, HMO and PPO plans, have a maximum out-of-pocket limit, abbreviated MOOP, M-O-O-P, for all Part A and Part B for hospital and medical covered services. So the out-of-pocket limit does not include any premium you might pay for the plan, does not. It does not include the Part D drug coverage, which is separate and has no out-of-pocket limit. It does not include anything you might pay for services Medicare doesn't cover, like dental or vision. Instead, it's only for Part A and Part B for hospital and medical. And if you reach that out-of-pocket limit, you have 100% coverage for the remainder of the calendar year for all Part A and Part B services. Now, these limits are going up for 2021. So next year, plans can have limits of as high as $7,550 in network, like an HMO plan, or $11,300 combined in and out of network for a PPO plan. So just to give you an idea about how that works, if you're in a Medicare Advantage HMO plan and you have a $7,550 limit, and you have a visit with a specialist, and that's $45 out of your pocket, that $45 goes towards the $7,550. If you're admitted to the hospital and it's $300 a day for the first 3 days, that $900 out of your pocket goes towards the $7,550. And if you reach that limit, most people won't, but if you do, again, 100% coverage for the rest of the calendar year for all Part A and Part B covered services. The other change for next year with Medicare Advantage is that people with end-stage renal disease, kidney failure, will be eligible to join Medicare Advantage plans. So what happens is, to be eligible for a Medicare Advantage plan, all you need is to have both Part A and Part B of Medicare. You have to live in the service area of the plan. And historically, people with end-stage renal disease have not been, with limited exceptions, have not been eligible for Medicare Advantage. But that's changing for 2021, and that will no longer be a restriction, and they will have the same right as anyone to join a Medicare Advantage plan next year. Now, that's all well and good, but they should be cautious about joining a Medicare Advantage plan, because typically, historically, Medicare Advantage plans have had up to 20% cost sharing for dialysis, up to the maximum out of pocket, in fairness, for all Part A and Part B services. But dialysis is a service that they're using very frequently and can be very costly. And 20%, it's a percentage. You don't even know exactly what that cost will be. As opposed to, if that person's on original Medicare with the Medigap, a supplement plan, between the two, they can have 100% coverage for dialysis. So with the HIICAP program that I represent, we never tell people what to do. Okay, we always want to let them know about their options, and we would always want to let them know that this is an option for them for 2021. But again, I would caution them before joining to check to see what your out-of-pocket costs would be for dialysis, okay, so that you're not surprised when you join the Medicare Advantage plan. Are there questions about those changes for 2021 for Medicare Advantage? Okay, so Sarah mentioned earlier that the Medicare Advantage annual election period is going on now. It's every year from October 15th to December 7th, where people can make any change, right? From one Advantage plan to another, to original Medicare, the other way around. If they're in original Medicare, they can change their Part D plan. And whatever the last election they make during that time, that's the one for them, which will be effective January 1st of the following year. But if they choose a Medicare Advantage plan for next year, there's another enrollment period. It's called the open enrollment period. It's every year from January through March, where anybody that's a Medicare Advantage plan has one additional opportunity to either change to original Medicare or to another Medicare Advantage plan. One time between January and March to be effective the first of the following month. You cannot use this to go from original to the Advantage, cannot. Or if you're on original Medicare, you can't change your Part D plan. No, this is only for people that are already on a Medicare Advantage plan. Again, to switch at the beginning of the year to another plan or original Medicare. Now, a lot of people are aware of this open enrollment period, January through March, but what they don't realize is that it's also available for people that are newly entitled to Medicare. If they choose a Medicare Advantage plan when they're first entitled, eligible for Medicare, they have the first 3 months of their entitlement to switch to another Advantage plan or original Medicare. For them, it's like January 1st. So for instance, if you know somebody that turned 65 this month, October, and today they have Part A and Part B and a Medicare Advantage plan effective October 1st, for them, it's like January 1. It's their own personal open enrollment period, October, November, December, to go with another Advantage plan instead, or with original Medicare. This is so important, but so overlooked because so many more people are becoming eligible for Medicare nowadays. It's becoming more and more common that they take A and B and an Advantage plan when they're first eligible. They may not realize they have the first 3 months to switch. Because who told them that? The Medicare Advantage plan they just signed up with? Maybe they forgot, right? So it's important for you to tell them as an advocate for that individual. And sometimes I find this is helpful for people that just can't decide. Okay, you might have spoken to people like this, right? No matter how many times you try to explain to them, original Medicare with the Medigap versus the Medicare Advantage, they just can't commit to a decision. So sometimes I'll say to them, well, it's your choice in the end. But if you do go with the Medicare Advantage plan, remember, you have that first 3 months that you're eligible for Medicare. If it doesn't work out, you change your mind to switch to another plan or original Medicare. And for some people, that's the deciding factor, okay, that additional flexibility. And then you might have people next year who may be reassigned to a different plan because their plan is terminating. So in some counties, we have Medicare Advantage plans with Part D that are terminating for next year, not in all counties. But throughout New York State, we have 2 companies that will stop offering standalone Part D plans. Okay, so you might have heard from members that are on original Medicare and have a standalone Part D plan, a separate Part D plan from either Magellan or from Journey. Those plans will be discontinued throughout New York State at the end of 2020. So what's going to happen to their members? Ideally, their members will select a different Part D plan for 2021. But if they do nothing, come January 1st, those that have extra help, okay, the low income subsidy. So people that have Medicare and Medicaid, for instance, or have the Medicare Savings Program where the state is paying their Part B premium, or who applied to Social Security and got full or partial extra help, a subsidy to help with their Part D drug cost, those folks cannot be without Part D. So if their plan is terminating and they're without, if they don't choose a plan, January 1st, they're just going to assign them to some randomly selected benchmark Part D plan. And a benchmark Part D plan is just a Part D plan that will be available for no premium for people that get the full extra help, including people with Medicare and Medicaid. But if you're on one of those plans and you don't have extra help and you do nothing, January 1st, you're going to be on original Medicare, but you're going to have no Part D drug coverage at all. And if you don't realize that until the first time you go to the pharmacy next year and you're still showing that Magellan card in January or February, luckily, there's a special enrollment period for those people who are on a plan that's terminating. It begins December 8th after the annual election period is over and runs through the end of February. So you can still help those individuals to get a Part D plan to be effective the first of the following month so that they do not need to be without drug coverage for the remainder of 2021. Also with Medicare Part D, you might have heard this is brand new for 2021. They're referring to it as the senior savings model. It's about insulin. So for those clients that don't have extra help, insulin can be very expensive under a Medicare Part D plan that covers it. However, there are some insurers that will be participating in the senior savings model where they will provide up to a 30-day supply of insulin, different types of insulin, for a fixed copayment of no more than $35. Okay, during the deductible phase, the initial coverage phase, the coverage gap, through the different phases of Part D, people will pay a steady $35 for covered insulin. Now, for those on original traditional Medicare, okay, they have 28 different Part D plans to choose from next year. 8 of these plans are participating. Okay, and again, that can be important for your clients that don't have extra help and are struggling with their insulin cost. They may want to consider one of these plans, okay, and they might be able to save overall on their cost if it meets their other needs. To identify these plans, if you go to the Medicare Plan Finder on Medicare.gov, there's a new filter. And if you click on filter, there's a box to check for insulin savings. And then if you do, it'll bring up those plans. If you're checking for Medicare Advantage plans, there are some Medicare Advantage plans throughout the state. Okay, not all, but some that are also participating in the senior savings model. Okay. So I could pause here if there's any other questions so far. Okay, so next is about another special enrollment period. And this is one that's very important to know about. It's a special enrollment period for people that get extra help. So all people that get extra help, again, the people that have Medicare and Medicaid, that have a Medicare savings program where the state's paying their Part B premium, the people that apply to Social Security and got full extra help or even just a partial subsidy. Unlike most people who can only change their plans this time of year, October 15th to December 7th, people with extra help can change their plan more frequently. Now, some of you may remember prior to 2019, people with extra help actually were not locked into a plan at all. And they were able to change as often as every month to be effective the first of the following month. But starting last year, they really cut down and made it more restrictive. And instead of being able to change as often as once per month, people with extra help can now change as often as once per calendar quarter in the first 9 months of the year. So your clients that have Medicare and Medicaid, they can make one change between January and March, one change between April and June, one change between July and September to be effective the first of the following month. During this last quarter, they have the same October 15th to December 7th annual election period as anybody else. Now, in addition to that special enrollment period, there's also a special enrollment period for people who have a change in their extra help status. So this could be for somebody, for instance, that becomes eligible for extra help for the first time or loses their eligibility for extra help. You might have somebody that loses it at the end of the year. They get a special enrollment period, or who has a change in the level of assistance. Maybe they have partial extra help now, but next year they're going to have full extra help. Okay? They're also entitled to a special enrollment period. And this is in addition to that once per quarter in the first 9 months of the year. In addition to that, okay, there is a special enrollment period for people that are being assigned to a plan or reassigned to another plan for next year. So the people with extra help that are in the Magellan plan now that's terminating, they're going to be assigned to a new plan for January 1st. Because they're being assigned to a new plan, they're entitled to a special enrollment period. Okay, and that's very important because when CMS, when the government assigns you to a plan, it's not based on your drugs or your pharmacy. It's just completely at random into what they call, again, a benchmark Part D plan. And a benchmark Part D plan is for people that are on original Medicare, and it's a plan that's available for no premium for people that get the full extra help. And again, these three special enrollment periods are in addition. They don't take the place of one another. So you might have somebody next year, let's say in April or May or June, they're turning 65. Before that, they have Medicaid through the marketplace, right? And when they turn 65, because they have Medicaid, they automatically get full extra help. Well, they're becoming eligible for extra help for the first time, special enrollment period. Because they have Medicare and Medicaid and extra help, they're going to be assigned to a Part D plan if they don't choose one on their own. That's another special enrollment period. And because it's April through June, all people with extra help have the special enrollment period during that calendar quarter. So for some people, they have more special enrollment periods than they can actually even use, okay, during that particular time. Okay, and these are all very good protections for people, again, that have extra help as to allowing them to change their plan. And when I say change their Part D plan, that could mean change their standalone Part D plan that works with original Medicare, or change their Medicare Advantage plan with Part D. And sometimes, you know, we get people that have a Medicare Advantage plan with Part D. They have extra help. They're in an enrollment period. They want to switch to original Medicare. Okay? And they have a lot of trouble switching. You know why? Because they make a big mistake. And that big mistake they make, they call their current plan that they're on. And their current plan that they're on says, oh, you want to disenroll from our plan? You got to send us a letter, right? And they send them a letter. Okay, and a couple of months go by, they don't hear anything, call the plan says, we never got that letter you sent us. That's a complete waste of time. Okay, don't do that. If you have a client, okay, that has Medicare and Medicaid or otherwise has extra help and they're in a Medicare Advantage plan with Part D and they want to go back to original Medicare, just enroll them in a standalone Part D plan, okay, one of those 28 for next year, okay? Those plans only work with original Medicare. And by default, it kicks you off the Medicare Advantage HMO or PPO plan and puts you on original Medicare with that standalone plan effective the first of the following month. Okay, we see people struggling to make a change when all it would have taken would be one call to Medicare, 1-800-MEDICARE, open 24/7 to do that, or right online, you can do the enrollment on the Medicare.gov website. Are there questions about that? Okay, so the last thing I want to talk to you about is about Epic. And this is often the most important thing that we talk to people about. Epic, for those that don't know, is New York State's State Pharmaceutical Assistance Program, SPAP. Okay? It's for New York State seniors, okay, reside in New York State, 65 or over, and have incomes from last year of less than $75,000 if they're a single person, less than $100,000 for a married couple. Epic doesn't look at assets or resources, whatever money you have in the bank, not concerned about that. Only income to qualify. But Epic does not work on its own. Epic only works as a supplement to your Part D drug plan. And it works with every Part D plan. Whether you have a Part D plan as part of your Medicare Advantage plan, or you're on one of those 28 standalone plans next year with original Medicare, doesn't matter. It's all Part D. Your Medicare Part D is your primary, your main insurance. Epic wraps around. Epic helps to fill in the gaps in coverage. Now, there's one gap that Epic will not help with, and that is your Part D plan deductible. So if you have a Part D plan with a deductible, which next year could be up to $445, Epic's not helping with that. But once you get past your deductible, Epic can help you to lower your cost at the pharmacy. And what does Epic cost for most people? For most people, Epic is free. So if you're a single person, to give you an idea, and you have an income between $20,000 and $75,000, like many people do, you would be in Epic's what they call deductible plan, where you don't have to pay anything for Epic, but you'll have to meet a deductible on a sliding scale based on your income before Epic will help pay for your drugs. But if you know somebody that has Part D and they have an income of $30,000, $40,000, $50,000, $60,000, I don't see any reason for them not to sign up for Epic. Sometimes people say to me, I don't use a lot of drugs. How am I ever going to reach this deductible? It's $1,000. It's $2,000. But I would say, so what? You don't reach the deductible. It doesn't cost you anything. It's free coverage. In the meantime, you have Epic in place should your situation change. And let me tell you one more benefit of Epic. Unlike most people who can only change their plan this time of year, Epic members can change their plan one additional time each year outside of the enrollment period. And for many people, it's worth it to join Epic just to be able to change their plans without having to wait till the next year. And if you're not an Epic member already, you can sign up anytime at all for Epic. And another way that Epic helps people is Epic helps people sometimes who never signed up for Part D. And now their situation is changing years later. So I don't know if you ever spoke to somebody like this, but we have people that they didn't sign up for Part D when they were first eligible because they don't use any medications. They felt it was a waste of money. Now, 5, 10, 15 years later, all of a sudden they got some new medical condition and they need some very expensive medications. Okay? Most people can't sign up, okay, in the middle of the year. Okay? But if they qualify for Epic, they can enroll in Epic first, even though they don't have Part D. They can enroll in Epic, which you can do any time of the year, and then use the same special enrollment period to get a Part D plan for the next month so that they do not need to be without drug coverage for the rest of the year. So a lot of times there's confusion because Epic requires enrollment in Part D. Epic only pays if the Part D plan pays first. Okay? But although Epic requires enrollment in Part D, they don't require enrollment in Part D first. Okay? You can enroll in Epic first and then get the Part D plan. And then some of you may have seen that they came out with a new Epic application, a longer Epic application, which asks for some additional information, okay, that they didn't on the prior application. So Epic bases eligibility based on income and income from the prior year. So if you're applying today, your 2019 income. But the new EPIC application they came out with also asks about your current income, and it asks you about your resources, your assets. Now, the reason EPIC is asking for that information is because if you appear that you may be eligible for extra help, but you're not receiving it, EPIC will then use that information and submit an application to Social Security on behalf of the member to see if they qualify for extra help. Okay? Now, but what they're doing during this COVID-19 pandemic to allow more people to enroll and not be a barrier with the new application is they're still allowing people to use the old EPIC application. Okay, so you can still use that. Or if you do use the new application, you can just skip those sections. Okay, leave those sections blank that apply to the current income and resources. And then what will happen is EPIC will send you a form later to get that information. Excuse me, but they won't delay the processing of your application. Okay, because again, they want to allow people to enroll during the pandemic. And then the other thing EPIC did relating to the pandemic is that for their fee plan members. So I said today, most people are in the deductible plan, okay, where they don't pay anything. And they have to meet a deductible before EPIC will pay for their drugs. But lower income individuals are in their fee plan, where they don't have to meet a deductible. Instead, they pay a fee to be a member of EPIC on a sliding scale based on their income. If these same individuals also have full extra help, EPIC waives their fee. But if they do not, they're responsible for the fee. Okay? What EPIC does in the past is they've canceled members for failure to pay the fee after a grace period. But they did not do that during the second and third quarter of this year. Okay? If they did not pay the bill, they just added them to the amount that was due to the next bill. Now people today have a fourth quarter bill from EPIC, October to December. And for some of those individuals, it includes the second and third quarter outstanding amounts. If they're not able to pay it because of the pandemic, what's happening now, they can contact EPIC and they can see if they can provide an extension. Okay, so that's the EPIC update. Were there other questions that you have today on? I know that's a lot of information in a short period of time. Okay, but are there other questions you have today on Medicare and related health insurance that I can answer?
Eric, we had a question from Maria Bowman. She wanted to know about the SNP for those with chronic diseases such as dementia. I'm not sure what her specific question is, but I'll send you an email if that's okay.
So Medicare, there's a type of Medicare Advantage plan called Special Needs Plan, SNP, that's only available for certain individuals. Okay, and selection of these plans varies by county. So in some counties, in many counties, we have special needs plans that are available for dual eligibles, for people that have both Medicare and Medicaid. In some places, they have special needs plans that are available only for people that are institutionalized, like in a nursing home. And apparently this question is referring to a third type of special needs plan for people that have certain chronic conditions, okay, specified by the plan. Okay, so if that's available and the person has that condition, they are able to join the special needs plan at any time of the year that they may be eligible, even outside of this enrollment period that we were talking about earlier.
Okay. Anyone else have any questions?
I do. When does it make sense for a veteran who's 100% disabled, service connected? When does it make sense for them to have Medicare or to not?
Yes, that's another good question with the veteran. You know, we see a lot of problems with veterans delaying enrollment in Medicare Part B as in boy, because there's different rules for Part B and for Part D as far as veterans. Okay, so let's start with Part B, medical insurance. So we said earlier that people can only delay enrollment in Part B if they are covered through their own or their spouse's active employment. That's the only exception. Sometimes veterans, because they get all their health care through the VA system, do not take Part B. Because they don't want to pay the additional premium for Part B. They're taking a big chance. Because if they're going to need to see a private provider outside the VA system in the future, and some of them realize that only 20, 30 years later, now they're going to have to wait, and they're subject to a large late enrollment penalty. Okay, so some veterans may want to have Part B just to give them greater flexibility to allow them to see private providers outside of the VA. Okay, we can't tell them they have to do that because Part B is voluntary for everyone. Okay, but we want to bring that to their attention. Part D, drug coverage, is different. The VA provides creditable drug coverage, okay, meaning it's as good or better than Part D. Veterans that don't sign up for a Part D drug plan can sign up during the next annual election period, like this time of year, without penalty. And again, some veterans may want to have both, the VA and Part D, in which case they'll work separately for their drugs. Either they'll fill them at the VA with whatever copayment, if any, the VA has, or having Part D will allow them to go to a private pharmacy outside the VA system for potential coverage of that medication.
Thank you.
Okay, you're welcome. Thank you for asking. That's important. Were there other questions? No, was that enough Medicare for everyone for today?
That was wonderful. Thank you.
Okay, thank you, Nancy. Thank you for having me today. And thank you to New York Statewide Senior Action Council for sponsoring my presentation. Thank you.
Yes, thank you so much to everyone for coming and the information. Next month is going to be all about housing, and it's going to be on November 17th at 2 o'clock. So if you guys have any questions that you want to send to Eric, or if you want to ask to Michelle, please send them to me if you don't have their information directly. And I think that's about it.
Thank you.
Thank you.
Thank you.